So, Craig, give us the elevator speech about ChenMed.
Okay, we're a primary care-led physician group that focuses on providing outstanding care for patients with complex needs. We focus on adults over the age of 55, and we provide excellent preventive upfront care and manage their entire outcomes and costs of care. We've also figured out how to scale this model, having grown from 5 centers in Miami to 36 centers across the Southeast United States.
So what's really innovative about ChenMed?
We have first focused on trying to strengthen the doctor-patient relationship. It's a basic concept, but we feel it can use a 21st century revision. We have our ratio of patients to doctors is 450 patients for every physician. And so the physicians spend a great deal more time with their patients over multiple years, and that relationship provides the foundation for behavior change. We also focus on barriers to care in this patient population that is low to moderate income and has, in the U.S., several disparities. We provide one-stop approach, we have transportation to the centers, on-site pharmacy, and a number of other services designed to make care more effective.
So could we describe ChenMed as a one-stop shop approach to primary care for older people?
Yes, we have tried to make it as easy as possible for patients to get the care that they need within the centers. We provide additional services such as acupuncture and diagnostics. And then over time, as we go into a new market, we develop strong relationships with the specialists, and many of the specialists come on site, including cardiology and behavioral health. We've also tried to coordinate care better across the transitions, and so have developed a separate group that provides care in the hospital, in the nursing home, and at home.
Can you describe to us how your funding works and the amount of money you get for different patients?
Yeah. There are two critical principles around funding. One is that we get a global budget, and the second is that it's risk adjusted. As a physician group, we get payment from the health insurers that have gotten a contract with Medicare for patients who have enrolled in a program called Medicare Advantage. The usual funding average would be maybe $8,000 a year per patient, but patients who are sicker or have more complex conditions, you can get as much as 2 times the funding, or even in some cases up to 3 times the funding. And the critical principle is that it is adjusted for severity so that you can create a system that actually is focused on the most vulnerable patients.
And you and ChenMed are taking financial risk in accepting these capitation payments for your patient population, which means there's a very strong incentive for you to deliver the right care in the right place.
That's correct. We're focused on delivering the best outcomes. In terms of financial risk, we do accept that risk, but we also have agreements with insurance companies that provide reinsurance and provide the right protection against that type of risk.
But it incentivizes your physicians to think about how they deliver good outcomes, but also minimize the cost of expensive hospital care.
Yeah, what we've been able to essentially do is increase the amount of preventive care and primary care up front and reduce the total cost of care by reducing preventable hospitalizations. We think that's a win for our patients.
How do you reduce preventable hospital admissions?
One of the big aspects is actually attentiveness to detail. And so oftentimes in many health systems, people will find out about ER visits or hospitalizations after the fact. Patients will come to their primary care physician and tell them they've been in the hospital, and this is new news to the physician. We've been diligent about increasing the information flow so we can get texts when patients go to the emergency room, or better yet, we have a physician on call 24 hours a day, so when a patient calls, we can make sure they get the care that they need before needing to go to the emergency room.
So the model is one of proactive, anticipatory care, trying to treat the patient in the right place so you can live within your budget.
That's exactly right, is that the key lever is behavior. We want to work with our patients and develop strong relationships so that they can take better care of their chronic conditions. And we want the physician to better understand the patient's particular needs so that she can be more sensitive to slight changes in those conditions.
So what impact has ChenMed had?
As a whole, we've been able to reduce hospitalizations by about 30%. As we have scaled the model over the last few years, we have actually seen our cost trends go down, not even flat or up. We also, within a particular market, have been able to reduce total cost of care by about 15%. Some of our new markets are performing just as well as our older markets. So we feel like we've been able to get innovation that gets at the heart of reducing the total cost of care through the proper way, which is providing more services and prevention up front.
And what do patients say about their experience of ChenMed?
Yeah, so in addition to making healthcare affordable, we've been able to increase the quality. So we receive top decile patient satisfaction, and we are in the top quintile of quality as measured by the regulators.
So if ChenMed is so good, why hasn't it spread even more rapidly?
Well, I think the key issue is not necessarily the one particular model. If I had one message, it's that patients with complex conditions need further investment up front in both time and expertise. And so while our model might not be suited for all systems and circumstances, some of those principles are likely applicable in almost any circumstance.
You've visited England before. You have some knowledge of how our primary medical care system operates. What do you think are the main messages that we should take from your experience as we understand it and try to adapt the ChenMed principles into the national health system?
I'd probably pose two questions. The first is, if there is an issue with outcomes in patients who have complex conditions, what can the system do to actually improve the quality, duration, and strength of the relationship between patients and the clinical team and the physicians? And the second question would be, is that if the satisfaction of the general practitioners and the primary care team is not where the system wants it to be, are there things that we can do that will elevate professional excellence and engagement? We believe that if you can elevate professional excellence, it's good for the physician and good for the patients.
Great, thank you very much.
Thank you.